A very good day, my dear undergraduate students. In fact, this class would befit all students facing pathology. I am glad to address you people after a long lull. The topic for the day is chronic inflammation. It appears very seemingly simple, but then a word of warning. Things are very abstract in general pathology. That alone we shall remember. Look at this picture, or rather an insert on the screen. It shows the crippled fingers of rheumatoid arthritis. The patient might not die of the disease, but rather with the disease. And all of you are well aware what kind of incapacitation this causes. Welcome once again, my dear students, to the class. Subheadings are subheadings. Think of the subheadings. The subheadings will take you to the answer. In this class, I shall be touching upon all these things. Definition. Inflammation is the response of a vascularized living tissue to injury. These words are all very important. A vascularized living tissue and the response. This inflammation itself is divided into an acute inflammation and a chronic inflammation. This topic is about chronic inflammation. Acute shall be for a short duration, chronic for a longer one. That much for now. And look at this. It is for the sake of continuity. This is a blood vessel. So the word vascularized has got a lot of meaning. So this is the endothelium. I'm able to see the RBCs. And there are some nucleated cells, namely the WBCs. There is a process of margination, pavementing, rolling, addition, and emigration. This will be followed by chemotaxis and phagocytosis. You people are all well aware of it. But then, what is chronic inflammation? That is our botheration for this class. The causes and then the aftermath of it. Once again, a beautiful picture courtesy Robbins. Now, we shall not only think of the cells, but also the mediators it produces. I would advise you people at every step to jot down some mediator, because difficult topics can be made easy this way. For example, in the mast cell, there can be the histamine. And in the macrophage, there can be the cytokines. Endothelium, again, there can be cytokines. Kindly make use of this picture. But that is not the purpose. This again is the endothelium, and in the lumen, I am able to see the neutrophil, the plasma proteins. Then there is a clear background. The platelets are there. Of course, RBCs are not seen. They all occupy an axial stream. Axial means right in the center. Axis means center. But when there is a slowing down, they move to the margin, margination, and then there is an emigration. So what is the use of this? The new leukocytes, neutrophils can be used for eliminating the bacteria. Plasma proteins, they can be mediators for inflammation. Lymphocytes, both for viral infections, chronic inflammations, as well as immune response. Monocyte is the blood counterpart or the hematogenous counterpart of the macrophage. And these are the other cells outside the blood vessel, namely the fibroblast, etc. So I hope this is very clear for you. A very complex picture made extremely easy thanks to Robbins and R.A.T.S. Now, why do we get chronic inflammation? Chronic inflammation can occur in a few conditions. One, persistent infections. They do not get cured within a few days. They remain with us for a long time. For example, the arthritis that I mentioned, synovitis, chronic sinusitis, chronic otitis. These are all chronic inflammations. Even tuberculosis is a chronic inflammatory lesion. Hypersensitivity diseases, strangely, they are also included under chronic inflammation, though I beg to differ. For example, bronchial asthma has all been brought into this fold because of the hypersensitivity reaction, but it can be horrifying. Prolonged exposure to toxic agents. For example, talc, silicosis, asbestosis. There is a continuous exposure and then there is an inflammation that is being caused. These all come under the occupational diseases. Low-grade inflammations. Some inflammations are not worth it at all, but then they live with us. Or rather, we live with them. Psoriasis. Granulomatous inflammations. This will be a separate topic, but then it is part and parcel of chronic inflammation. If you are asked a question on chronic inflammation, please do include granulomata also. In this case, the inflammation, it persists for weeks to months, or sometimes it can even go to years. These are the examples. Granuloma, for example, mycobacteria. Viral, chronic viral hepatitis. Autoimmune disorders such as rheumatoid arthritis, SLE, systemic lupus erythematosus. Bacteria causing a low-grade infection. Sinusitis is a classical example. Toxic insoluble substances, suture material, asbestos, silica, when they are all left within the body, they cause an inflammatory reaction which will not be threatening, but it can become crippling. The cells of inflammation, namely the white blood cells. This is again a beautiful chart, thanks to Robbins. There are the granulocytes and the agranulocytes. A means absent. Anemia, absence of hemoglobin. Granulocytes are cells which have got granules, which means neutrophil, eosinophil, and basophil. Depending on the color, they are labeled so. Neutral means neutral. Eosin means bright brick red colors. Basophil is blue colors. And look carefully, even over the nucleus, I am able to see the granules. They say it obscures the nucleus. I am making use of it because I did not want to waste this picture. But we are more concentrated on the right side of the picture, namely the lymphocytes and the monocytes. So lymphocytes themselves are divided into the B lymphocytes, T lymphocytes, and the NK cells, natural killer cells. What is the response, etc.? We shall be dealing slowly in immunology, etc. And monocyte, as I told you, this is the hematogenous counterpart of the macrophage. All of these are involved in immune responses, in mediators of inflammation, as well as in fighting the persistent bacteria and viruses. Continuing with the cells of chronic inflammation, the macrophages. You find that the macrophages are the tissue counterparts, therefore they are fixed. Kupffer cells, there is a found in the liver. Lung, there are the alveolar macrophages. Histiocytes in any connective tissue. Brain, microglia. Bone, osteoclast. And lymph nodes and spleen will be having again the histiocytes. Langerhans cells are found in the epidermis. So these are some sites where we will be having fixed macrophages. We will have it in mind. But if that is difficult, this is a wonderful stupid mnemonic I picked up. I modified it a little bit and I would like you people to kindly see this. After all, if it is anything but the subject, the students will like. So long ago, King Bahubali ordered blind man should have a sweet life as King Meghalaya in Lakshadweep for a peaceful heaven. God alone knows what it means. But let us see the meaning of it. These are the highlighted letters. Liver, Kupffer cells. Bone, osteoclast. Brain, microglia. Spleen, histiocytes. Skin, Langerhans cells. Kidney, mesangial cells. Lung, dust cells or the alveolar macrophages. Placenta of Bohr's. So, I think it is a wonderful mnemonic. Due credits to the person who created. Now, what is the origin of the macrophages? We are still dealing with the macrophages. There are two sites of origin. One is the bone marrow. In the bone marrow, we have got a cell called the hematopoietic stem cell. There are a lot of stem cells. One is a committed stem cell called the hematopoietic stem cell, from which you will be having the promonocyte and then the monocyte. Also, you can have the dendritic cell that is originating from it. These monocytes are converted into macrophages in the event of any chronic inflammation. So this is one origin. Stem cell macrophage. The next one can be directly from the yolk sac. From the yolk sac, you get tissue resident macrophages. So there are two origins for the macrophages. We shall remember them alone. The other cells are the lymphocytes, plasma cells, eosinophils. Eosinophils, again, they are involved in parasitic infections. Mast cells. The mast cell is supposed to be a tissue counterpart of the basophil. So please remember the names of these cells. These should not be difficult. Otherwise, it will appear like Greek and Latin to us. So again and again, I go to a diagram. I got a habit of going to a diagram. A simple picture is worth a million words. So this is the blood stem cell. There is a myeloid lineage, lymphoid lineage. The myeloid lineage, actually it is myeloid erythroid. So you will get all the erythroid precursors. You will get the megakaryocytes and the platelets. And you will get the myeloblast. From the myeloblast, we get different granulocytes. Eosinophil, basophil, neutrophil. Beautiful. For one side. As I told you, I am interested on the right side. There is the lymphoid stem cell, lymphoblast. B lymphocyte, it gets converted into its cousin, the plasma cell. Another cell for inflammation. Then there is a T lymphocyte and the NK cell. Please remember this. It is a beautiful picture. It will be useful for us throughout pathology. The plasma cells, as I had mentioned. Look at this. So this is an oval cell in a 2-dimension. But literally it is like an egg, ovoid, 3-dimensional. So the nucleus is eccentric. This is the nucleus over here. It is eccentric. And around the nucleus, there is a clear space called the perinuclear halo. The chromatin will be in the form of a clock face. It is arranged in a clock face like pattern. The cytoplasm is, I won't say totally basophilic, I would call it somewhat grayish. So this is the appearance of the plasma cell. Now what happens? As I told you, it is the lymphocyte, the B lymphocyte facing the antigen gets matured and this gets converted to the plasma cell, eccentric nucleus, ovoid cell, and this produces the antibodies to fight the antigen. So that is the purpose of the plasma cell. So this is another chronic inflammatory cell. We have seen the macrophages, we have seen the lymphocytes, and we are seeing the plasma cells. And also remember the eosinophils for parasitic infestations. Now, what is the difference between an acute and a chronic inflammation? So this is a very simple table which I think you people should practice, not very difficult at all. Duration and the manifestation. It is very rapid and it occurs in a few minutes to hours. Chronic, it is slow, indolent, lasting for several days or months. Cellular infiltrate here is neutrophils. In this case, it can be monocytes, lymphocytes, plasma cells mainly. Macrophages in the tissue. Tissue injury and fibrosis. Usually you find it is mild or self-limited, but in some conditions it can be severe, as in a case of acute bacterial meningitis, acute myocardial infarction. Whereas in a chronic, it is severe and progressive, chronic arthritis. So, why it is also will be seen. The local signs and symptoms are very prominent. There will be redness, excruciating pain, all the signs of inflammation will be there. Whereas they are all less prominent here, subtle or crippling rather. Fibrosis is minimal. This is what I said. Progressive. Ultimately, it is the fibrosis that is a culprit in a case of chronic inflammation. It incapacitates the person. You cannot bend a joint or straighten it. The function is interfered with. So I hope you people have understood the difference between acute inflammation and chronic inflammation. Compare. Comparison is the enemy of creativity. So it's a beautiful quote, quote spread. I thank you people for your attentive listening to this short class. See you in the next class.